So proud of myself. This is my second live video. Hello everyone. Just playing around my new light. It's a little tilted, so I gotta be like down here. But anyways, welcome. So my first live video, you can go back and look at it. I was talking about risks of formula feeding in hopes that it encourages a lot of moms, mothers who are at the breastfeeding stage, ability to breastfeed their babies and newborn babies. Hopefully it'll encourage them to do so at least for the first 6 months of their baby's life, which is also known as exclusive breastfeeding. And pardon the way my lips and everything is bent because I'm very insecure about this missing tooth over there, but whatever. Let's go. Just pay attention to the message, all right? Don't judge me, and I won't judge you. Because it could get ugly before it get beautiful. You know how it goes. Anyway, so last live I talked about risk to formula feeding. I'm just going to go past that. Kind of summarize a little bit. Risks to giving your newborn baby formula feeding. Increased risk for certain respiratory diseases, risk of asthma, increased risk of allergies, reduced cognitive development, increased risk of dental malformation, increased risk for infection from contaminated formula, increased risk of nutrient deficiency, increased risk of childhood cancers, increased risk of chronic diseases such as diabetes, cardiovascular disease, increased risk of obesity, increased risk of GI infections, that is your gastrointestinal tract, that's everything to do supporting how you eat and how you release your waste, increased risk of mortality, which is increased risk for death, increased risk of otitis media, which is ear infections, increased risk of environmental contaminants. And last video I also mentioned that breastfeeding is not just beneficial for your newborn, but it's also beneficial for mothers. And if mothers choose not to participate in breastfeeding, well, let me tell you, you have just increased your risk for developing certain breast cancers, risk for being overweight. Because one thing for sure that I noticed when I breastfed my children, damn, I disappeared. I was skinny in a month. I was so slim. I lost so much weight. Increased risk of ovarian cancer for mothers. Increased risk for endometrial cancers. Because I know that when you breastfeed, a lot of breastfeeding moms can agree that when you breastfeed, it helps your uterus to contract, which helps to bring it back into its normal position, to its original state. So I can see the connection with developing certain ovarian and endometrial cancers. Increased risk of osteoporosis, reduced natural child spacing. And what that means is if you exclusively breastfeed, and some moms, some women is just totally against certain birth control options that's available and offered to them. And if you exclusively breastfeed, this can be used. Do your research, and I'm gonna give you a little bit more information, but it can be used as a natural birth control family planning method. For moms, it also increases stress and anxiety if you don't breastfeed. Increased risk of developing rheumatoid arthritis, increased risk of maternal diabetes. So with that being said, I want to talk about what can you do, like at the start, like what can you do from the very beginning to establish your milk supply. And please do not go against recommendations from your physician, from your provider. If you are advised not to breastfeed for whatever reason, because as I mentioned before, certain medications, certain diseases can be passed to your newborn, through your breast milk to your newborn. So please be cautious. If it is not advised for you to breastfeed, listen, the best baby is a fed baby. Just feed your baby with the formula, okay? As I mentioned before, a lot of times there's several reasons why a mother is unable to breastfeed. So listen, the best type of baby is a fed baby. This is not to make any breastfeeding moms feel bad. However, it's natural to feel bad whenever you're unable to do something that's supposed to come natural. And that's one thing that I struggle with for quite some time, because I was not equipped with the knowledge or understanding of the processes of breastfeeding and establishing a well milk supply. And even if I did try all of the options available, pardon me for itching, my scalp is itchy. Who knows if it would affect my milk supply, but I'm just so grateful that each one of my children was at least able to breastfeed for at least the first year of their life, every last one of them. At times it was a little frustrating because it seemed like, excuse me, that the child was hungry. You did not hear that. Excuse me. Hungry after feeding. I'm like, listen, maybe they're not getting enough. Like, maybe they're not getting enough milk. So, of course, you know, with Caribbean parents and family, they like, listen, they will recognize the signs of a hungry child, and they would go ahead and supplement my child with milk and formula. And of course I would too, because you know there's no way that I want my baby to be hungry if I'm not being able to fill their stomach. Like, we all know what it feels like to be hungry. It's a very uncomfortable feeling. So you have to do what's best for you, but however, there's certain things that you should do from the beginning, right? From the beginning, within the first hour of delivery, your baby should be provided with that breast milk. Sometimes babies is born prematurely. Sometimes they have difficulties with sucking or latching onto the nipple. And in future videos, we'll get onto establishing a proper latch with your baby. But sometimes you're not able to get baby onto the breast within the first hour of delivery. Perhaps mom went through a difficult delivery, difficult labor, just exhausted. Whatever the reason is that you cannot get baby to latch on within the first hour, you want to at least ensure that you are expressing your breast milk. So ensure that before you deliver, you have a breast pump. There's so many different types of breast pumps that are available to you. Your insurance, if you have insurance, they pay for it. If not, you can go on Amazon and surely find a cheap breast pump. I will, in another video, give you a selection of breast pumps that some of my very own patients, they rave about. They swear it's the best thing for breastfeeding mothers. And I'll share that with you on a later video. So that's number one. You want to try to pump within the first hour of delivery if you cannot get baby on your breast within the first hour of delivery. Just to have baby on your body, something known as skin to skin, that is when baby is completely naked. If you opt to have a diaper on baby, is fine. On your bare chest, that kind of helps also to stimulate certain natural things that's happening in the body in order to facilitate breastfeeding. Okay. Number two, you want to make sure you are adequately hydrated. I mean, a lot of the times we running around as new moms. Sometimes you have multiple children at home, multiple things going on, and we don't take the time to make sure that we are eating the proper nutrients and drinking enough water. So I want to show you a picture of this My Plate. This My Plate is very important. This is something that should be introduced to you from as soon as you find out you're pregnant. Like, this is something that should be introduced to you from the beginning of pregnancy. Now, this is something that I show all of my patients, and then we educate them on it. It's something known as My Plate. You see that? And this shouldn't just go for pregnant women. I think it's a good idea for everyone to kind of follow this diet. I mean, of course, unless you have allergies and you won't have to be on a special diet because of some type of medical issue or whatever, then you follow that plan that your provider has advised for you. However, if you are perfectly fine, no health issues, we encourage our moms to eat this way. And it's called a My Plate Planner. And all it's demonstrating, you don't have to eat exactly what's on this plate, but it's demonstrating how you should portion your foods. So this is the typical plate. And once you prepare your plate, immediately you should be placing half vegetables. Like when you're preparing your meals, half vegetables. Say it with me. Just slap half of your favorite vegetables onto the side of this plate. And I'm not talking about green peas and corn. Those type of vegetables have a lot of starch, and if you was to eat it, it should fall into this food group right here. This is your starch food group. Quarter of your plate should be your starches, and that includes bread, rice, pasta, potatoes. That's because this food group right here is responsible for driving up your blood sugar, and that can be dangerous because pregnancy can bring about a whole host of issues, and one of them is known as gestational diabetes, which is diabetes in pregnancy. So you want to be very careful with this particular food group, as well as your proteins. And your proteins include your chicken, beef, fish, beans, anything like that, okay? Very important. As you can see on the side, water should be adequate. Fruits, depending upon what's going on with you, because like I said, some of our moms develop gestational diabetes, so they have to be careful even of fresh fruits, the fresh fruits intake, okay? So that's number 2. So what do we say? We have to get started early within the first hour of baby's life. Secondly, we have to make sure our diet is on point, okay? And we are drinking enough water. Thirdly, I want to mention the importance. A lot of y'all gonna be mad at me after this one. Breastfeeding, just think of it like a job, okay? You don't want to go to, but it's necessary. Just gotta go. You should be expressing your milk at least 8 times a day. I said it 8 times a day. So think about it. That's like every 3 hours, including the middle of the night. That's a job. That's a job. There we go. So breastfeeding at least 8 times. That's about every 3 hours. So even if your baby is asleep, you should be facilitating that breast milk out of the breast, whether if it's baby latching, okay, using a breast pump, or you just simply expressing your milk with your hands. And there's certain techniques that can help you achieve doing that as well. Pardon me, I brought too many of my educational papers here with me. And I just want to look for one in particular. Give me a second. Alright, so I'm gonna need this. Alright. Alright, so this is another one of the educational materials that we provide our patients. And it says, why express your milk? Why should you express your milk? Because it builds supply, especially for moms who do not have enough time to stay home with their children, as long as some moms do, some moms take months, sometimes moms say years, but some moms have to get to work literally within days and weeks of giving birth, okay? So it helps to build your supply for when you return to work or anytime you're just away from your baby. At least you'll have something that whoever is caring for your child, they can also provide those healthy nutrients to your baby. It increases your milk production if it's done frequently, and like I mentioned, at least, you don't have to be 8 times a day, but the least 8 times a day, okay? As well as it decreases your chance for something known as engorgement or other complications. Like, some of our moms know, you let that milk build up, it can become so painful. So also expressing your milk also provides some level of comfort when it becomes uncomfortable, okay? So there's different ways you can express your milk, as you can see right here. You can express with your hands, okay? And as you want to squeeze towards the back of your chest and then compress and then relax the nipples. So I ain't gonna do too much. I don't want Facebook, YouTube to hit me with any type of sexual and graphic anything. So then you can use a breast pump, okay? That's a different way to express your milk. And like I said, baby, can latch directly. All right. Also, sometimes babies, like I mentioned, some of them cannot latch right away. You know, they're just born. Their muscles is brand new. It's a little weak. It's not as strong as it will build up to. But there's also different alternate ways to feed a baby. Like I mentioned, if they cannot latch, right? There's cup feeding. There's special cups that you can provide your breast milk and give baby. There's spoon feeding. You can feed your baby with a spoon. Okay, finger feeding, that's with a special tube, and you just utilize your finger, and that provides the additional suction for baby to receive the nutrients. And you can also feed your baby via syringe. Either way, you getting those nutrients into your baby. Now, I wish that someone took the time to provide this information for me when I was breastfeeding my baby. But you know what? It is what it is. It is what it is. All right. So before I close off, I would like to just discuss some additional benefits to breastfeeding. All right. Just in case what I've discussed with you so far doesn't motivate you or encourage you to do so. Okay. So breastfeeding gives you the opportunity to provide that skin to skin. As I mentioned, skin to skin doesn't have to only be done with mom. It could be done with dad. It could be done with grandma. It could be done with grandpa. And it provides the bonding and attachment that babies need to feel safe and secure along their journey of development. Skin to skin promotes breastfeeding. It helps to regulate body temperature, because we all know newborns, they're at risk for losing body temperature. That's why they immediately put that cap on their head, okay, to help to regulate their temperature, their heart rate, and their breathing. Skin to skin does that alone. All right. There's also a lot of facilities that promote something known as rooming in. Rooming in is when your baby stays with you at your bedside from the time you give birth all the way up until the time you are discharged home. Well, of course, there are some situations where baby is not going to be able to stay in your room because of, some type of medical complications and things of this nature. However, if it's a normal delivery, normal birth, you should opt into a baby-friendly hospital that provides this type of accommodation known as rooming in, and the baby will stay with you in the room. And this helps you to learn your baby's cries for like when you get home. It prepares you for real life, because if your baby is in the nursery for 24 hours while you're in the hospital, like, how you gonna get used to the routine of home? Like, how you gonna recognize, okay, this cry is unusual. Like, I know baby cry like "Wah," when they hungry, but this one is like maybe they in pain. So that's another benefit of rooming in. Okay, it also helps you to learn your baby's cues. Now, what do I mean by cues? Back in the day, they would be like, okay, feed your baby every 3 to 4 hours. Where's my paper? I probably don't have it, but I don't need a paper to discuss this. So, research and studies have shown that babies can also show signs of when they're hungry, feeding cues. Like a lot of times, moms are over, like, I just fed you. I just fed you. But baby will let you know if they're hungry. Sometimes they'll stick their hand in their mouth. They'll see them sticking their little tongue out. Of course, naturally, when they just woke up from a long sleep, they naturally gonna be hungry. So try to learn your baby's feeding cues and their signs of hungry. It also helps with establishing your milk supply because you and baby is bonded. So it lets you know, I'm hungry. Let's get this thing moving. Let's get it flowing. All right. Keeps baby happy. And once again, like I said, it decreases your chance of engorgement when you feed baby by cue and on their demand. Okay. So I think I gave enough, right? This video is already at 22 minutes. So those are some few tips that I'm providing to just help you establish your milk supply. All right. If you have any questions, any comments, leave them below, and don't forget to hit the like button. It looks like that. Like that. Like that. Thank you for those supporting me, all right? And have a good night. See you later. All right, I never could remember how to turn this off. There you go. Poop.